When you dive, the pressure of the water affects your air spaces as well as your breathing. The air spaces include your lungs, sinuses, and middle ears. You can also have air spaces in your stomach, intestines, and teeth. There are also two air spaces outside your body that you need to consider when diving. Those are your mask and dry suit. Pressure can affect these spaces in dramatic ways, called the direct effects of pressure. When you descend, the pressure on your body increases at a rate of about 0.1 bar per meter, or about 0.5 psi per foot of depth. Whenever the pressure outside an airspace is greater than the pressure inside an airspace, the situation is called a squeeze, and it can cause damage to your body. This is known as barotrauma or pressure injury. The types of squeezes divers experience are in your sinuses, middle ear, or mask. You can avoid each of these squeezes by proper use of equalization techniques. A reverse block is the opposite of a squeeze. It occurs when the pressure inside an airspace is greater than the surrounding pressure. Blocks can occur during ascent. The airspaces inside your middle ears are especially important when you dive. You must be able to equalize the pressure inside your ears to comfortably and safely dive. Your middle ear has an airway, the eustachian tube, that links it to the back of the throat. Your middle ear transmits sound waves from your eardrum to the auditory nerves of your inner ear. Your body's balance mechanism is contained in the inner ear. If you have a sudden change in pressure or temperature in one ear and not the other, you can get dizzy or experience vertigo. A middle ear squeeze occurs when the air or water pressure in your outer ear is greater than the pressure in your middle ear. You equalize your middle ear by moving air from your throat through the eustachian tube into your middle ear. If you cannot equalize your ears during a dive, you must end the dive and return to the surface. As you descend, the pressure on your outer ear increases and pushes in on the eardrum. If the pressure continues to increase and is not equalized, pain will be felt. The eardrum flexes in to help equalize the pressure and can rupture, allowing water to flow into the middle ear to equalize the pressure. Before you feel the slightest pressure in your ears, you need to equalize. Some divers can equalize by swallowing or wiggling their jaw, but most divers require a bit more effort to open the eustachian tube and equalize the pressure. The most common method for equalizing is simple. You close your mouth tightly or block it with your tongue if on scuba, close your nostrils by pinching them shut, and exhale lightly. As you build up pressure in your head, you should hear the pressure open the tube, a gentle pop. You must never force this technique. You could seriously damage your ears. The key to successful ear equalization is to keep the pressure difference between the water and the middle ear to a minimum. This means that you must equalize early and often, starting at just beneath the surface. If the pressure difference between the inside of your ear and the water becomes marked, the pressure will hold the eustachian tube closed. Once this happens, it is unlikely that you can do anything at depth to open the tubes. Your better choice is to ascend a few feet and reduce the pressure difference until the tubes will open, and then attempt to equalize again. In some cases, you will have to return to the surface and start the descent over. Never try to equalize pressure in a squeezed ear by performing forceful blowing. Blowing hard against a closed nose and mouth will not open your eustachian tubes if they are held shut by pressure. Descending feet first also makes equalizing much easier for most people. Always remember to equalize early and often. If you have a head cold, you must not attempt to dive and equalize by any method. Never use earplugs for skin or scuba diving. Earplugs trap air between themselves and the eardrum, and there is no way to equalize this airspace. A reverse block can occur if your eustachian tube becomes blocked while you are at depth. If you begin to ascend and your ear hurts and feels full, stop your ascent and descend until the feeling goes away. Swallow, wiggle your jaw, and start ascending slowly. You might need to repeat this technique throughout your ascent. If the block does not equalize and you must surface, close your nose and mouth and breathe in. If nothing works, ascend as slowly as possible. Your head has 4 sets of sinuses. Each of your sinuses is connected to your nasal airway by an air passage. Under normal conditions, the passages are open. When you have a cold or congestion, the sinuses will clog. If air is trapped inside a clogged sinus and you attempt to dive, you will feel pressure on your sinuses. If you continue to descend, the soft tissue surrounding the sinus will be pushed into the sinus as the tissues react to equalize the pressure. This is quite painful and can cause blood to flow into the sinus and fill it. If you cannot equalize your sinuses normally during descent, it will fill with body fluids. Then, during ascent, the air in the sinus will try to expand to its original volume, but it can't because of the fluid. Pressure builds in the sinuses and pain results. Blood can be forced out of your nose, mouth, or mask. Any gas that forms in your stomach or intestines during your dive will expand during ascent. This can cause discomfort. To prevent this situation, avoid eating gas-producing foods before you dive. If you have an imperfect filling in one of your teeth, air can get under the filling. When you descend, the air in the space can compress, causing pain. Upon ascent, the compressed air can loosen the filling or fracture the tooth. As the water pressure increases during your descent, the mask is pushed against your face and the air inside the mask compresses. If you don't add air to your mask, the air pressure inside the mask will cause your mask to suck tightly on your face, causing tissue damage. This is known as mask squeeze. You should never have this type of injury because you can easily equalize pressure inside your mask by simply exhaling a small amount of air through your nose into the mask. If you wear a dry suit, you have an airspace surrounding your body. As you descend, the air in the dry suit will compress. To keep the suit from squeezing, simply add air to the suit using the power inflator valve.